Okay, we're going to record the lymphatic system. You realize that the lymphatic system is the drainage system of the body, or the sewer system. It's meant to expand whenever there's something to drain and collapse when there's something not to drain. So you normally shouldn't feel it unless there's drainage. And if there is drainage, you have to think, where has that drainage come from? Therefore, you examine each system by the regions. And other body systems that are involved in the hepatic system, or the lymphatic system, are the spleen. And you want to, the tonsils are the only lymphatic system that you can actually visualize. So what you want to do is inspect the visual nodules and surrounding area for edema, erythema, or any kind of red streaks. Palpate any superficial nodes and look at these things: size, consistency, the mobility, any kind of discrete borders or matting. And matting is when lymph nodes move in groups together, like they're kind of matted together. And is there any tenderness or warmth whenever you palpate it? There normally should not be any tenderness when you palpate lymphatics. So realize that the lymphatics consist of lymph fluid, ducts, lymph nodes. The spleen is a big contributor or organ to the lymphatic systems. The thymus is very important, especially up to puberty, and that is retrosternal. The tonsils and adenoids and the Peyer's patches, and the Peyer's patches are in the intestines, and it helps drain the intestines. The lymph tissue is located in multiple systems, and it's including the mucosa of the stomach, appendix, and bone marrow, and the lungs. And it's throughout the entire body except in the placenta and in the central nervous system. So here's the picture of where the thymus is, the spleen. And the spleen should be something that you do not percuss. That's going to be greater than 2 inches. And you're going to percuss that on the side. And this is letting you know where you'd find your major lymph nodes. You realize that the lymph nodes will drain particular areas of the body. And what you really want to notice is, where would this body be drained? And so you're going to know where to examine if you find lymph nodes. And there's a couple of things that you should remember. The parotids are commonly inflamed with anything in the head. But if you find any supraclavicular or subclavicular lymph nodes, that is always pathological. And there's some kind of pathology in the chest or in the abdomen. But finding supraclavicular or subclavicular lymph nodes is never normal. Finding lymph nodes in the groin area, the inguinal lymph nodes, is normal if there's any kind of rash or infection in the abdomen or in the genitalia. Okay, and this is telling you the brachial lymph nodes and the epitrochlear nodes. The immune system and its function is to protect. The lymph node system really does help the immune system because it protects bodies from antigenic substances. It removes damaged cells. It has a partial barrier to malignant cell mutation. But the problem is there can be a lot of mutation throughout the lymph system. When it functions well, the individual is immunocompetent, but when it fails, it can be due to a variety of illness, like an allergic illness, immune deficient, or autoimmune diseases. The immunological and metabolic processes is movement of the fluid in a closed circuit. There's production of lymphocytes, and that is often in the thymus and also in the bone. There's a production of antibodies and phagocytosis. Phagocytosis is basically where the lymphatic tissue eats everything up in front of it, similar to what the old Pac-Man game was on computers. And it absorbs fat and fat-soluble substances, and it manufactures blood when primary sources are compromised. And that's coming out of the spleen. Lymph is composed of clear fluid. It's mostly white blood cells, occasionally red blood cells, and proteins. The drainage is from bloodstream to the interstitial spaces. There's no built-in pumping mechanism in the lymphatic system itself. What pumps it is the muscles contracting around it. So if those muscles have been debrided, then it's going to have problems contracting to be able to bring that lymph back to the heart or to the kidneys in order to be pumped out. All right. Lymph nodes are discrete structures surrounded by a capsule and composed of connective tissue and a few elastic fibroids. Usually appears in groups. You receive the lymph from collecting ducts. It is located superficially in a deep body. Superficial nodes are accessible to inspection and palpation. The lymphocytes are central to the body's response to antigens. The B lymphocytes tend to produce antibodies. T lymphocytes are an important role in controlling immune responses, and they're brought in by the B lymphocytes. And the T lymphocytes come often from the thymus, the B lymphocytes from the bone. And the thymus is located in the superior mediastinum, extending upward into the lower neck. Primary function in infancy and childhood, it tends to get its maximum weight at puberty, but then it's basically, as an adult, the thymus doesn't have a lot of function in the body. It tends to shrivel up. So here's a picture of where the thymus is on an adult, and look how big it is on a child compared to the rest of it. On the adult, where it tends to atrophy, but on a child it can extend up into the neck. The thymus produces antibodies, and what it will do is, if there is some kind of virus or if there is some kind of infection, this is why if a child gets that infection as a child, they're better able to fight it off than when an adult gets a major viral infection, such as HIV and AIDS. And so HIV as a child, you would be able to get more lymphocytes to fight it than if you were to get HIV as an adult. The spleen is situated in the left upper quadrant of the abdominal cavity. It's a blood-forming organ early in life. It's a site for red corpuscular storage. It contains blood-filtering macrophages. And the immune response to the blood-borne antigens usually has its origins in the spleen. Tonsils and adenoids. The Palestine tonsils, they're the ones you see when you look in the throat. And the lingual tonsils are at the base of the tongue. Usually the Palestine tonsils are bigger, and you don't even see the lingual tonsils. And realize that that they're there to catch things so they don't go down into the respiratory tract. And they do swell up as a defensive response to inhaled and intranasal antigens. Pyropatches, small raised lymph in the mucosa of the small intestine, and they consist of many clustered lymphoid nodules, and they serve the intestinal tract. Infants and kids have an antibody production that is immature at birth. Thymus is the largest relatively to the rest of the body shortly after birth. Tonsils are larger in early childhood because that's when you're having a lot of viruses and bacteria in the mouth, because kids just put everything in their mouth. Lymph node distribution is the same as adults, and the lymph system gradually reaches adult competency during childhood. Pregnant women, pregnancy is a state of an altered immune function, and with the implantation and fetal development. So there's an enhancement of certain immune mechanisms and suppression of others. In pregnancy, leukocyte count will tend to increase in order to accommodate all this extra blood and all the, be able to, because of your blood, overall plasma increases about 25% with pregnancy. And the mother's hormones and the products of the fetal trophoblast create a unique environment for the intrauteral foreign body. But they work together, so there's not a rejection. Older adults, the number of lymph nodes may diminish, the size of the lymph nodes decrease, some of the lymph nodes elements are lost, and the nodes of older patients are more likely to be fibrotic and fatty. Therefore, their decreased ability to fight infections. What do you want to know on the history of the present illness? The character, associated local symptoms, associated systemic symptoms, predisposing factors, and medications. You want to notice if there's any swelling of the extremity. You want to notice, was there any predisposing factors like surgery? And is there any, the other predisposing factors? You can have swollen extremities and pedal from prolonged sitting, like on air flights, long flights, or just long sitting, long road trips. Unilateral, bilateral, or intermittent swelling. What's the duration of the swelling? And efforts to treat it. You want to find out if there's any chest radiographs, because that's going to let you know if the thymus for some reason doesn't shrivel up as an adult. You can be able to see that on the lateral view of the chest x-ray. TB, if they've had any TB or other skin issues, because that's going to allow for a lot of, wherever this skin rash is, you would expect the lymph that would be catching that area to inflame. If there's any blood transfusion, chronic illnesses, surgeries like mastectomies, that type thing. Recurrent infections, autoimmune, and allergies. Family history, find out if they have any malignancy, any history of cancer and where it was at, any anemias, recent infections in the family, if they've ever been exposed to TB, immune disorders, or any hemophilia. Personal and social history, you want to know travel, and you basically want to know those that would have problems with to these areas, because you can get some very bad lymphoiditis with filariae diseases that are common in Asia, Africa, especially Eastern Africa, Zanzibar. You get filariasis, and that's between mosquitoes and that carry it. The Western Pacific, India, and the Philippines. Find out if there's any use of recreational drugs, especially the injected drugs, use of alcohol, and any sexual histories for increased risk for HIV exposure. Infants, look at recurrent infections, present or recurrent infections, trauma, digital to nodes, poor growth, failure to thrive, loss of interest in play and eating, immunizations, maternal HIV infections, or hemophilia. Pregnant women, ask the weeks of gestation, the exposure to rubella and other infections, and the presence of pets in the household, because you don't want them around. You don't want cat scratch issues, or you don't want them dealing with the cat feces. Older adults, the presence of an autoimmune disease, presence or recurrent infections or trauma, distal to the nodes, or delayed healing. So on the examinations, you're going to use the marking pencil, and you're going to use a ruler, something to measure with. You're going to inspect and palpate disorders of the lymphic system, like enlarged lymph nodes called lymphadenopathy, red streaks, lymphangitis, and lymphedema. Look at the lymph nodes, edema, erythema, red streaks, and any skin lesions. Palpate to detect any kind of enlargement, consistency, the mobility of the lymph nodes, any tenderness of the lymph nodes, the size and the warmth of the area. And you're going to note on the nodes if they're hard or they're more likely to be malignant. The more tender the nodule, the more likely the inflammation. And nodes do not pulsate, arteries do. And so that's a differential that you'll need to know. Because a lot of times you're on an artery, you're not on the lymph node, because they run right next to each other. And a palpable supraclavicular node on the left is a clue to abdominal or thoracic malignancy. And this is called, if you find a supraclavicular node, it's called a Virchow node. So that's important to remember. It's usually on boards that a supraclavicular node, you've got to get a chest CT or MRI, depending on what you can measure, of the chest and the abdomen. Here you're palpating the preauricular nodes, and you want to palpate the lymph nodes and do it in sequential. Do the occipital nodes at the base, and you got a picture of these in your book, and the next sequence of how you want to go down the nodes. So what I do is I do preauricular, then postauricular, parotid, and the sternocleidomastoid. The occipital nodes are back here on the back of the head, and then you've got your internal jugular vein, then you've got your supramandibular, and then the submental. And you don't always find the sublingual lymph nodes, but here and there you do, but it's not one that's commonly found. Other areas you want to palpate are the axillary, epitrochlear lymph nodes of the elbow, inguinal and popliteal nodes of the legs, inguinal in the groin, popliteal behind the legs, and the spleen. So you want to look at the lymph nodes in the abdomen and realize this is where they're going to drain from. You have a good chart in your book, box 9.3, when lymphadenopathy requires further investigation. And you need to look at that and also look at the clinical pearls drugs that increase lymph nodes, and pick those out of your book. And they're on page 228 and 229. Technique for the examination of infant and kids are the same, but realize that enlarged lymph nodes are common in kids because they're getting most of their viral illnesses at this point. An enlarged postauricular or occipital is not unusual in children younger than 2 years old. Enlarged cervical, submandibular, less frequent in kids younger than 1 year old, but more frequent in those greater than 1 year old. Enlarged tonsils is common, not necessarily abnormal. You don't pull them out unless there's problems, because they do have functioning in the lymph system. And realize that enlarged tonsils, one side bigger than the other, doesn't mean that there's any illnesses. So what are the abnormalities that you're going to look at? You can look for acute lymphangitis, is inflammation of one or more of the lymph vessels. Acute suppurative lymphadenitis. Let me say that again. Acute suppurative lymphadenitis is an infection and inflammation of the lymph node. It may affect a single or localized group of nodes. Lymphedema is edematous swelling due to excessive accumulation of lymph fluid in tissues caused by inadequate lymph drainage. And you see the lymphadenitis in this baby in the left leg. Abnormalities is lymph angioma, and this is a congenital malformed or dilated lymphitis. You can have lymphatic filariasis. It's also called elephantitis, and this is what I was talking about in Zanzibar. It's a massive accumulation of lymphedema throughout the body. It tends to be in one leg more than the other. The scrotum can get the lymph apathy, the lymphedema that's so big that the testicles can be the size, I've seen testicles the size of softballs, and the scrotum will go down to the knees. It's huge. One leg will be as big as an elephant leg, the other leg absolutely normal. But it tends to be both inguinal nodes are bad, but elephantitis tends to be worse in one leg than the other. You can have both legs swollen. The sad thing is once they're that swollen, you can't do much about it. You can wrap them and elevate them, but they'll never go back to normal size. You have to kill the filaria, or you can kill that with medications, but it's hard to get the lymph system back to normal. You can have non-Hodgkin's lymphoma, and you've got pictures of this in the back of your chapter, and in your chapter, malignant neoplasm of the lymphatic system and the reticular endothelial tissues, Hodgkin's disease with malignant lymphoma, and Epstein-Barr viruses can lead to infectious mononucleosis. Toxoplasmosis, like zoonosis, caused by a parasite, and it's a zoonotic disease, so you get it from animals. You can get HHV6, infected by the human herpes virus 6, and then you can get herpes simplex virus. You can get the herpes simplex virus 1 is in the mouth, and 2 is in the genitals. And how I remember it is you have one mouth, and then it takes 2 to get HSV2. Cat scratch disease, common causes of subacute or chronic lymphadenitis in children. AIDS, and the problem with that is dysfunction of cell-mediated immunity, serum sickness, or hypersensitivity. You can get latex allergies. This tends to be a later in life delayed hypersensitivity. There are some children that have a lot of latex allergies, and those would be your spina bifida children, those children that are exposed to a lot of surgeries earlier in life. And latex allergy type 1 is due to true allergic reaction caused by the protein antibodies. And the problem with latex allergy type 1 reaction is that latex molecules are inhaled. It's when you snap off a glove or pop a balloon, the latex molecules are going to be in the air. Or when you paint, or like walking into a tire store and they smell all that latex, those molecules are in the air and can have a real hypersensitivity to that, resulting in respiratory arrest. So these children should always have an EpiPen. Thank you very much. This is the end.